You're listening to the Big Blue Podcast. I'm Leigh Goodson, president of Tulsa Community College, and I'm here with my co-host Greg Stone, provost of the Metro Campus. We're at Southeast Campus today, Greg. It's History Day.
I love History Day.
It is fun. I had the opportunity to walk around and see some of the kids from schools. Hundreds. We have hundreds.
It's a big deal.
It's a really big deal.
Lots of employees volunteering as judges today. I'm not judging myself this year, but I have before, and it's a lot of fun.
Yeah, it looked like it was a lot of fun. Well, our guest today, welcome Jessica Heavin.
Yes.
Did I say that right?
Yes, you did. Thank you.
Good. Okay, I got it on the first try. I love that. We're glad you're here. You're our new Director of Wellness Services for Tulsa Community College, so that's a pretty big responsibility. So you have college-wide responsibility.
I do.
Okay. so you're going around all. It sounds like what we do, yeah. But it's fun. It's fun to see all the campuses and everything that's going on throughout the college. So you started here pretty recently in December. Can you talk to us a little bit about what you did before you started here at Tulsa Community College and why you decided you were interested here?
Sure.
So this isn't a job interview. I just want you to know. That sounds like something you'd say.
That's okay.
Why are you interested in this job? Yeah, no, okay.
So I've worked in educational environments for the majority of my career. From 2004 to 2008, I worked for Springfield Public Schools under the Safe and Drug-Free Schools grant. And then I moved to the Tulsa area in 2008, and I became the coordinator of counseling services at Rogers State University in Claremore, and I served in that role for 3 years. I then went into the private sector for 5 years. I did some work for a local employee assistance program, and I just found myself missing higher education and the students and the environment and prevention and programming and all of those new challenges that you get to do when you're working in education. So when I saw the posting for this job, it felt like the perfect fit for my career experience and also the path that I saw myself going. I used to adjunct at a community college in Springfield.
Nice.
And I loved it. I loved my students.
Yeah.
I loved the atmosphere. So I could not be more happy to be serving in this role at TCC, and I feel very humbled to be given the opportunity to do that.
Well, we're glad you're here. It's hard to beat the mission, isn't
Yes.
it?
Yeah, exactly.
Yeah,
Yes.
it's so easy to live the mission of Tulsa Community College.
Absolutely.
Well, great. Well, welcome. Glad you're here.
Thank you.
Jessica, not only are you new to the college, but the department that you're over is new as well, Wellness Services. Tell us about the vision of the department. What's its mission, and in what ways does it benefit our students?
Okay. Well, our mission is sort of, in a nutshell, holistic health for our students, not only while they're here, but kind of taking that and running with it once they get into their career paths. So I see this year as sort of a pilot, as we're a new department on TCC's campuses. There's going to be a lot of things that we try that work and a lot of things that probably don't work, and I see us as kind of fine-tuning our services this next academic year. By March of next year, I really hope that we're completely up and running with 2 licensed professional counselors who can sort of provide some consistency on our campuses, post hours, see students, and do that counseling and connection piece. What we're really looking to do is short-term counseling for our students and making sure that we are connecting them to the existing community resources. I've been in Tulsa for 8 years, and I can tell you we have a lot of community resources for our community members. And so I feel like our role is to provide that short-term service and then connect our students up in the community with any kind of long-term care needs that they have. We are also going to be doing a lot of faculty and staff trainings over the next year, as well as partnering with Student Life to provide some more comprehensive health education programming across all of our campus locations. Just a little piece of research. There's been a lot of work done on whether or not counseling on college campuses equates to student retention. And there's a couple of studies that say about 65% of students who visit with a counselor will persist to graduation.
Interesting.
Yeah.
That's a big
Yeah.
deal.
Yeah, so
Yeah.
we are going to be doing that same kind of work, linking what we're doing with student retention from the get-go. And we have some software programs and things we're going to be using to help us follow up with students appropriately that we've visited with. Ask them how their academics are going and whether or not our services are linking to that graduation and retention piece. So that's very exciting. And I hope to not only get to that 65% mark, it would be
Exceed it.
great to exceed it.
Yes.
Yes,
Right.
it would.
Yes.
Well, it makes so much sense that, I mean, so many of our students, because of the population that we serve, we can do a lot internally to remove our own barriers, but we know our students are working, so many work full-time, have families, are caring for parents. I mean, there's just a lot of pressure on them and at some point that pressure is going to break.
Absolutely.
And we need to be there to provide that support and, like you said, connect them to those community partners, those agencies in our area that can help provide more of that support.
Yes.
Yeah.
And I wanted to take this opportunity to mention that the college also just recently approved what's called a student assistance program. And it works a lot like an employee assistance program, only it's available to every single student that's enrolled. And that program, they provide basically problem assessment, and then they will help connect and refer that student through the network of community resources. The thing I love about the student assistance program is it's 24/7. It's a 1-800 number that any student can call any time of day, any day of week. Any day of the week, and be connected to that service, because unfortunately crisis doesn't always happen between 8 and 5.
That's right.
So that number for students, if they're listening, is 1-800-327-2251, and we hope that students will use that service.
Can they find that on the website as well?
Not yet, but yes,
But yes,
it's
it will be
coming.
there.
Yes.
Good, good.
And certainly we'd encourage faculty, if they encounter students that may need some assistance, to refer them to that number,
Yes.
right?
Yes.
Yeah, good. So we have a lot of partnerships at Tulsa Community College. That was one thing that I learned when I started. Everybody is partnering with our college in some way, shape, or form. And I think a lot of that is because we're a good partner. We're good to partner with. We do what we say we're going to do, and we follow through. And that's our reputation in the community. So that's strong. We have a partnership with DVIS, Domestic Violence Intervention Services, that you work with. Can you talk to us a little bit about that and what services our students can access through DVIS?
Absolutely. Well, just to kind of cite some data here, unfortunately, Oklahoma is 4th in the nation for homicides that are related to domestic violence. And we are also in the top 10 in regard to numbers of sexual assaults every year. And so in 2015, TCC partnered with Domestic Violence Intervention Services here in Tulsa, and we now have a counselor dedicated to helping students with anything related to domestic violence, sexual assault issues here on our campuses. So Lauren Gonzalez is our DVIS counselor, and she's here about 3 days a week, sometimes more than that, and she travels around to all 4 campuses. And she provides crisis intervention, referrals for basic needs. She will assist that student with any kind of hearing at both a college and a criminal level. And she does advocacy for police reporting and sexual assault exams. Not to mention safety planning, because that's a huge piece when you're working with anybody who's been affected by domestic violence. So she's also been a great partner for our student life directors and assistant directors in providing programming for our students, educating them about domestic violence, stalking, sexual assault, and those kinds of issues. So I see her as a huge piece of what Wellness Services is trying to do, and a great partner for us. In just 2.5 months of being here, I've already consulted with Lori more than once, because she just has all of this excellent expertise and 15 years of experience working with people who've been affected by domestic violence.
Such a strong organization in Tulsa, too.
Absolutely.
Yeah, we're all lucky to be working with each other.
Absolutely.
Yeah, good.
Our guest today on the Big Blue podcast is Jessica Heavin, who's TCC's new Director of Wellness Services. And Jessica, you mentioned this a little earlier, that Wellness Services really is about sort of taking that whole person approach. And that's a shift for the college, where in recent years up until recently, I should say, we've focused a lot on health, and this is a shift, part of a shift the college is making to focusing on wellness. Can you talk to us about the difference between those two things, and is this something that's going on in higher ed in general? Sort of what's the big picture when it comes to health versus wellness?
Sure. Well, I think that I think there is a shift in higher ed. I don't have any, hard data facts on what kind of programs are out there, but a lot of colleges do have some sort of place on campus that they're labeling as a wellness center or wellness services. Wellness really encompasses physical, emotional, spiritual, environmental, financial, intellectual, occupational, and social areas of life. So that's a lot, right?
Holistic. It's holistic. Yeah.
So when you look at that wellness wheel, as a college, we had a lot of those areas covered, so to speak. Our physical health for our students, of course, we have the fitness centers. Intellectual health, we certainly are hoping that they're getting that out of their coursework or other learning opportunities that they have. Our social, we have student life that offers excellent opportunities for students to become engaged. But when you looked at us as a college, we didn't have any place that was addressing emotional health for our students. And when you look at health outcomes, emotional health has a huge impact on physical health outcomes, quality of life, all of those things. And so in making this shift, we hope as a college, if we're addressing other needs, not just physical health, then the students will take those skills and apply them once they are graduated and out in their career paths. And hopefully it's going to be a building block for them for a long and healthy life. So that's what we hope.
I'm going to pivot for just a second, and it's about Title IX. Everybody talks about Title IX, and it's so funny when you're not talking to somebody that's not in education. They're like, you don't have to deal with Title IX. You don't have any athletes.
Right.
Everybody still thinks it had to do with equity in athletics, but it's so much farther than that now. But all of our employees go through Title IX training each year, and it's they learn about their responsibilities, essentially saying if you know something's happening, then you are obligated to bring it up with your concern. But you, in your role, are a confidential reporter. Can you talk to us about what a confidential reporter is and what that means for our students and employees?
Sure.
Yeah.
Well, every individual has a right to make a decision about formal reporting. And so we just want to be really clear and transparent about where students can go for different types of discussions, different types of reporting obligations. We want to empower victims to make that decision, whether they want to report or not, on their own time, and give that control back to them. So we really want to create a culture of safety for victims and allow more victims to come forward to get the resources that they may need, again, to make those decisions or move forward with reporting or not. And so a confidential reporter role is that person that someone can consult with, knowing that they can do so in a completely confidential manner. As long as there's no threats to others that could affect the entire campus community, that confidential reporter can be just that, a confidential advocate. With that being said, I think that TCC has an excellent support system for people who do want to report. And my job as a confidential reporter is just to have those discussions, talk about the pros and cons, reporting versus not, and again, give that power back to the victim to make that decision for themselves.
I bet that's a tough position to be in sometimes, but
Sure, yeah.
But the students, I'm sure, really appreciate it. Yeah,
Absolutely.
for sure.
Jessica, as we kind of start to wrap up, what are some of the most important things that all of our employees, faculty, and staff need to remember in terms of their own individual roles in helping to look out for the safety and wellness of our students?
When I used to do faculty and staff trainings at Rogers State, I would always say that the faculty members are our eyes and ears. So not all students who are having any sort of problem are going to show up at wellness services. but they are in the classrooms and they are engaged with other students and faculty members. So my goal is to empower our faculty and our staff members to know what to do if a student is in crisis, who to call, what to do, and alternatively also know what not to do if that crisis occurs. So I'm going to be offering some trainings in the next, even this semester, this spring, called Mental Health First Aid in Higher Education. It is a research-based, evidence-based best practice on a national level to help people who work in a college know what to do if a student has a mental health crisis or is experiencing symptoms of a mental health issue. So we want them to feel empowered to know what to do if it's an emergency. And on the flip side, if it's not an emergency, then what does that discussion look like? And basically it's listening, giving information, guiding students to take the resources that might be able to help them. And, you know, I always kind of go back to our campus police say, if you see something, say something. And it's really the same thing with mental health issues. Yeah.
Well, we call this the Big Blue Podcast because of the big question. All right. So if you could go back, Jessica, and give advice to your 18-year-old self, what would it be?
I had to really think about this question.
I know. We make sure we give this particular question ahead of time because we don't want anyone to not have the opportunity to consider it.
Well, what I decided I was going to say about this particular topic is, like hundreds or maybe even thousands of other TCC students, I am a first-generation college student. And so I kind of always tell the story that I was one of those students that glided through high school. I made good grades. I didn't really have to study. I really didn't have to think about it too much, to be honest. And when I got to college that first semester, it was sort of a rude awakening that, oh my goodness, I'm going to have to exert a lot of effort to get where I want to go. And so I did. I taught myself how to study. And got a lot of feedback from different faculty members along the way of how best to do that. And I'm very proud to say I graduated with a 3.9 and went on straight into a graduate program and into my career path. So
congratulations.
Thank you.
If I'd have graduated with a 3.9, I'd be talking about it too.
You know, anywhere I can slip that in.
Yeah, that's right. Absolutely. You worked hard for it.
I think all of that is to say that persistence pays off.
Yeah.
And I
Good.
truly,
Good.
I truly believe that the skills that you need to be successful in college can be learned and honed over time. And that's what it was for me, just learning how to do it. So
That's great. Well, you've been listening to the Big Blue Podcast, coming to you today from Southeast Campus at History Day. We want to thank our guest, Jessica Heavin. It's great to have you with the college, and thanks for taking some time to visit with us today.
thank you.
We also want to thank you for listening. I'm Greg Stone here with Dr. Leigh Goodson, and we'll hope to have you join us next time. Thanks.
Thank you.
Thank you.